everybody, it's Professor Miller. Just wanted to give you an introduction to the course and welcome you to Nursing Pharmacology. It's Nursing 3041. It was previously 308, so you might see that on your plan of study. Obviously, they changed the numbers recently. I wanted to do a general overview of the course and go through the course syllabus with you, just kind of give you a layout of the course and our course calendar as well. So we'll take a look at Part B of the course syllabus and Part A as well. If you scroll down a little bit under here, under the course essentials, obviously it's in that folder where the course syllabus and calendar. We have the course internal email and then the course announcements as well. And I'll kind of describe these as we kind of go through the syllabus together and take a look at it. So let's take a look at Part A first. So Part A of the course syllabus essentially is more of structured by the School of Nursing, and it kind of gives you the outline of the course and, the general credits and information like that. So we'll kind of briefly go through this because a lot of it is in Part B as well. So obviously at the beginning it gives you the credit hours and the total amount of semester hours, and also has my contact information on there as well. My office is at 2031 Human Health Building. I do practice, so, I'm kind of in and out. If you do need to get a hold of me, the best route is through email. And I'll kind of describe that as we go through Part B as well, because we typically use the internal email system within the course. However, I don't mind if you do send me an email through my OU account if it's something urgent. But typically I try to use the internal email system within Moodle just to keep the course organized and making sure that I don't miss any emails essentially from you guys. So essentially the course overview is written on here, the prerequisites are written on here, which was pathophysiology, and we'll take a look at this in Part B because I have all this kind of listed in there as well. Course objectives, once again, I'll kind of go through that as we go through Part B. Same thing with the essential content. In terms of technical requirements, obviously you have to have internet access. This is an online course, and logging into Moodle. Obviously, if you're watching this, you already probably know how to use Moodle by now anyways. But there are some help documents through Oakland University eList system if you are having difficulty. They do have some good resources on there that you can also use as well. It just gives you some general overview of academic conduct, and we do also have the School of Nursing handbook, which also has expectations for the School of Nursing as well. There's also the American with Disabilities Act, so if you do require any services or supplemental help, essentially you can contact the office there and you can schedule an appointment. So that is available. We also recommend that students complete evaluations towards the end of the course for faculty teaching effectiveness and how the course ran. I always recommend that students do this because it's really how we know what works for the course, what's not working for the course. The feedback that you have obviously is very important to us. I do also add a midterm course survey, and then I also add a final course survey within our actual course that gives you a little bit more room essentially to give more feedback and write that feedback in there, and it's anonymous. So, I do value your feedback and hope that you can complete these. Student nurse professionalism. This is obviously through the School of Nursing and, making sure that we, meet these professional standards. And it is within the School of Nursing handbook as well, which you can look at through the School of Nursing website. ATI testing, we'll discuss this a little bit further. With ATI testing, you actually, within the School of Nursing, as you enter the program officially, you will take ATI tests throughout the program, essentially. And you'll find out more about this when you go through orientation for the nursing program. ATI testing essentially is all in preparation for your NCLEX examination. So it's meant to identify those strengths and weaknesses that you have in certain content areas. So a lot of your courses will have these ATI tests integrated within. Pharmacology is typically one of them. However, we are changing this a little bit, and it will basically be at a later point. So right now it's actually not a requirement for our particular course, but it is something that, that you can take at a later point, specifically for pharmacology. So for our class this semester, we don't have to do this, but I did add on our course Moodle page an ATI book. It's a PDF file that you can look at. And sometimes students use it for studying because it kind of helps lay out the material in a concise format. You can use it as like an extra resource if you want. So I will open that up on our course Moodle site if you want to take a look at it. In terms of emergency preparedness, obviously this is an online course, so much of this doesn't really pertain to us, but you can take a look at this and review this on your own. And then at the bottom of Part A, we also have the School of Nursing grade conversion chart here as well. Any School of Nursing course, you essentially have to have a 70% to pass, so 2.5 essentially, in order to proceed, and pass the course and proceed through the program. So this is the School of Nursing grade point, scale that we use, and this is what we use for the course as well. So now let's take a look at Part B. Part B of the course syllabus is a little bit more geared towards the course layout and kind of how the course runs essentially. So same thing, this is Part B of the course syllabus. You can gain access to this on the main Moodle page. Once again, my office location is at 2031 Human Health Building. Like I said, I do practice and I teach over at Aintan Franklin Center too. So I'm kind of in and out over on main campus, here and there. So the best way to get a hold of me is through our course email system, the internal email, if you don't mind using that. Like I said, though, I am, if you need to get a hold of me urgently or it's something, that you need a quick response, you can definitely email my OU account, and that's at crmiller23@oakland.edu. I'm very, very good about checking email, and I'm really good about checking my internal email through Moodle. On your end, I don't believe you can have it set up like a link where it'll show on your main Moodle page, so you actually literally have to click on it and go in and look at your email to make sure that you don't have any. I do try to post announcements, and the announcements actually are linked up with your actual OU email account. So if an announcement is ever sent out through the course, which I do try to do pretty frequently, it does send you an email to your OU account essentially. In terms of office hours, we can definitely schedule any time that you may need. So if you ever feel like you need any help, I'm here to help you. So a lot of students, I know it's difficult because everybody has different schedules. People work. A lot of people are still working currently through this course. So a lot of times we actually meet up through WebEx, which is actually very, very easy to use. It's a great tool for online courses because we can actually, you meet essentially in live time, and I can share my screen. You can share your screen with me. So we can, always set something up through WebEx, or if you would rather meet in person, we can definitely schedule something like that as well. So always feel free to reach out to me if you ever need any help with anything with the content or studying tips. I'm here to help you. So in terms of the course description, we're going to explore essential pharmacologic principles and the pharmacologic actions of major drug classifications, which basically lays that foundation for your nursing management of drug therapy. The big thing that I always stress to students, and I put it in a file too on there for pharmacology study tips, is make sure that we're focusing on drug classes, which you'll understand as we kind of move through the course. Pharmacology has a lot of content. There's tons of different drugs. So the big thing to understand is that we have to learn the drug classes. And then each classification will have, select prototypes or, basically drugs underneath that classification. So learning the drug class is what we really try to focus on within our course, and basically pulling in that nursing management with it. So when we look at, the different medications, essentially, we're looking at the major drug classes. And then you kind of pull out a prototype or two that are underneath it, and you kind of will understand that drug based on what you know about the classification. And another big important thing, too, is a lot of pharmacology relies on your previous knowledge of, physiology or pathophysiology, because a lot of times drugs work through our normal mechanisms, and you'll kind of get that as you start going through some of the lectures. So we look at major drug classes throughout the course, and we look at the integration of patient variables. So, taking a look at the elderly, looking at the pediatric population during pregnancy. So it's really pulling in those other factors as well. And the big thing too with, with nursing and healthcare essentially is that we really have to try to pull in the application of pharmacotherapy as well. So it's not just memorizing this stuff, but it's also trying to think about, how are we going to manage the patient? What are we looking for with the patient? So it's kind of, going out and branching out into those application areas as well. So the course is essentially designed to form a foundation for your future nursing courses, and it's really, truly a very integral part of your professional nursing practice. So, it's important, to stay up to date with the content, and, if you need help, please let me know. In terms of course objectives, basically defining those basic pharmacologic principles for drug therapy across the lifespan, looking at mechanisms of action of major drug classes in relation to the normal physiologic and pathophysiologic states. So when we go through drug classes, I do try to, that's another tip I always give, is try to link it up with the pathophysiology or the disease state that you're treating. It makes it more memorable if you link the two together. So try to, picture it in terms of like the treatment of a disease, or, how it pertains to the physiology as well. So we'll look at essential components of pharmacotherapeutics, nursing interventions that support it, in basically providing safe, effective, evidence-based care. We do, they introduce the nursing process within your textbook, and this is going to be all new to you because a lot of you have not had any other nursing courses to kind of support this. The nursing process is essentially like a systematic way of basically, developing a plan of care for your patient, assessing your patient, and you'll see this as you move through other future nursing courses. But the nursing process essentially is adapted, within your textbook to fit pharmacotherapy essentially for patients. So it's basically just looking at the pharmacodynamics, the pharmacotherapeutics, all through like a systematic process, and looking at it with, in conjunction with a patient case scenario or something like that. So we'll take a look as we kind of move through the course as well. Looking at different rationales for specific drug selections, I do try to pull all this out within the course lectures, looking at the proper dosage, route, administration. That's another thing that I stress too, as you move through future courses and you start practicing as a nurse, you're always going to be looking this stuff up. You always, when it's new to you, you have to look it up when you're in the clinical setting. So don't focus too much on exact dosages or, specific routes unless I bring it up or something within a lecture. Because a lot of those smaller little details of a dose or, how many milligrams, that's stuff that will come with time. It's more about learning the overall classification, the main major side effects. What are you looking for in the patient? It's very, very difficult to remember dosages at this point in time, unless it's something that I bring up. So don't focus too much on that. Minimizing adverse events, and I try to pull this in as well, and maximizing therapeutic effects in patients. In terms of course prerequisites, obviously, like I mentioned, we have pathophysiology, and your general anatomy and physiology are also course prerequisites as well. So in order to truly understand pharmacology and to to process it and to learn it, it really does rely on your understanding of pathophysiology. Because a lot of times these medications or their mechanism of action essentially work through our normal physiologic state. And you'll understand this more as we, move through different drug classes as well. So at any point that you feel like you need a refresher on your pathophys, please do that before you kind of move into the drugs, because it definitely will help you understand and learn it versus just trying to memorize stuff, essentially. I do always put up a lot of resources. I have Moodle books up on there, and I always put a lot of different patho videos in there, and just to try to tie it together for you, and pulling that pathophysiology in as well to give you a refresher. So, those are there for you to review if needed, essentially. As I mentioned, it does rely on that pathophysiology. It's an essential building block for this course. So like I said, review it if you need it. And basically, if you need any further help or any other resources, please let me know as well. In terms of the required textbook, it's actually a really, really good book. It's Lean's Pharmacology for Nursing Care, the 9th edition. They do have a 10th edition that I think is coming out this month, but we're using the 9th edition for the summer semesters. and it's 2016. It is available through the OU bookstore, or you can even look on like Amazon or something like that too and obtain it from there. Previously, we've used SurePath for pharmacology, or actually, we're going to change that and kind of go from using that. The majority of students really did not find it all that helpful, and actually sometimes it almost gives you too much information, and it kind of, you lose focus on what's important to know. So the big thing with how to approach the course, and I'll kind of go through this when I'll put a video up covering the first module, and I'll kind of give you an understanding of how to approach the course content as well. But really what you should do is kind of take a top-down approach through the postings on Moodle, look at the lectures, listen to the lectures. You can download the outlines, and I would really refine your reading as well, because there's a lot of small print in the textbook, and that stuff's really not the areas that you need to focus on. So you really got to learn how to refine your reading alongside with your studying as well. And I try to do this with the lectures essentially, so that way you know where to kind of focus on the material. So anyways, yes, that's a required textbook. If you have any, issues, obviously, please let me know. In terms of recommended references, there are different references that you can utilize. There's different mobile applications that you can, download. There's Epocrates, which I've used previously a lot, which is really good. It has, it has all the medications in there, but it also has, sometimes it'll have labs in there or different diagnoses in there. Unfortunately, a lot of these applications are more medicine-based, so a lot of times you're not going to find like IV compatibility or nursing interventions necessarily. It's more based with medicine, essentially, because medicine and nursing can be very different. And UpToDate is a really, really good one. It probably has more than what you would need. I personally use UpToDate as a nurse practitioner. You can download UpToDate and Epocrates through the OU library system, because UpToDate is actually very expensive. And you do get it through the OU library system under the medical library if it's something that you're interested in. You don't necessarily need this. It's just something that if you want an extra resource, you can. The other recommended resource that students sometimes ask about, because you'll need it in the future for your clinical courses, is a drug guidebook, a nurse's drug guidebook, which one of them is Davis's Drug Guide for Nurses, and there's multiple editions, but you can get, the newest one or whatever. But it's a small handbook. I mean, you can't put it in your pocket. It's larger than that, but you can put it in a bag when you go to clinical. But the good thing with that one is it gives you like IV compatibility. It gives you nursing interventions. It's strictly for nursing, essentially. And that's, again, it's Davis's Drug Guide for Nurses. So that's, if you're, want to purchase something else, that's, totally up to you. But it is recommended once you move into clinical. You don't necessarily need it for this course, but if you want to get it, you can get that at this point too. In terms of class format, obviously it's an online course. So, obviously we participate in asynchronous activities. So this may be online discussions, assignments, or quizzes. So we don't traditionally meet, on a weekly basis or anything like that, but you're expected to participate within a specific window of time. So a lot of times we'll have course discussions, and I'll go through that as we look at the calendar, but we'll have case studies that we go through. We have course quizzes that we also go through, and I'll have this all laid out in the course calendar on our course Moodle page. So we'll take a look at that as well. In terms of rules of netiquette, obviously, we want an open exchange of ideas here, so we want all students to feel free that they can express themselves and have their views respected. So at no time, we don't want any inflammatory language or any inflammatory responses in any discussion forums. So we're here to support one another, and we're here to help each other. So anytime, we have discussion forums and, you're doing a response, we're not here to pick apart each other's work. It's more about learning together. So just keep that in mind as well. In terms of using Moodle, we kind of already went through this. You already know how to probably access Moodle if you're watching this. In terms of course requirements, so late assignments, the course quizzes, and your course discussion forums, which is the other assignment that you will have. I do give you a pretty good amount of time. I have it set up within modules. So usually this isn't an issue. Most people are on time with it, and it's usually not problematic. But essentially I just have it written down that if if you're late by a day, then we mark it down by 10% of what, off your initial point value, essentially. So just keep that in mind as well. In terms of computer access, obviously, make sure that you have good internet connection, especially when you're going to take quizzes or exams, because the exams are online. It isn't recommended to use smartphones or tablets just because it can change the format there. So make sure you have good internet connection as well. If you do have, obviously, a problem, please let me know. Technical skills, you can kind of take a look at this as well. In terms of course evaluation, the course essentially consists of our case discussion studies, and we'll have that essentially set up within each course module, and I'll kind of show you that on our main Moodle page. So that's basically where we have discussion questions that surround different case studies. We have content quizzes, so the content quizzes are also coordinating with the weekly sections, and then we also have a final exam and a midterm exam. So if you find that you're having difficulty with the assignments or the quizzes, please let me know. There's always ways that I can help, or I can always give you feedback of how to tailor your studying or something like that, or give you some recommendations essentially. Just remember that I'm here to help you, so always feel free to reach out to me. Email me, let me know if you have any concerns, questions, etc. In terms of exams, they are both online. So the midterm and final exam are scheduled online within our Moodle course. I do give a good amount of time, like a window of time that you can take it, because I do understand that a lot of you still work, and everybody has different schedules. So a lot of times I'll leave that midterm exam open from the morning until the evening, like late evening. So at any point during that day, you can take the midterm or final exam. The final is non-cumulative. It basically covers material after the midterm exam, and then the midterm covers that first 4 weeks of course material. I will post all the dates on our course Moodle site. Always go from our course Moodle site. I do have it all written in the course calendar, but I always recommend, just to make sure that you look at the course Moodle site frequently to make sure that it's still the same. And I do always give announcements and, prior to the exams, and kind of give you some more information on that as well. They do consist of critical thinking or application type questions, and these are very similar questions to what you'll see on the NCLEX examination. So the earlier that you're introduced to these, the better off you are, because once you enter the nursing, accelerated program, a lot of your tests are like written this way, and you'll kind of get a feel for it once you take like one of the quizzes. The quizzes are structured very, very similar to the course exam. So that's why the quizzes a lot of times are very good, because it helps you prepare for the course midterm and finals. So we'll kind of look at this as we move through. System content quizzes, and this is the quizzes that we will have for each weekly section, and they're integrated within each module, which I'll show you in the course calendar. Course quizzes, I really truly try to tell students, don't look at these as like a test. Look at these as a learning activity. I know everybody thinks of it as a test, but I try to have students think of it as more of a learning activity. Quizzes are really, believe it or not, quizzes are really, really good for learning, because number one, it assesses your strengths and weaknesses, but it really truly facilitates like you're learning at a higher level. And it basically helps you master that course content, because it'll pull out those areas that you don't understand. Going through certain questions like that will, it'll help you understand those nursing style questions. I always give a ton of feedback within the course quiz questions. So after it closes, I always recommend that students go back in like that day after and look at, basically review the feedback in there, because I try to put a lot of detailed information in there as to why the answers are what they are. The process to how to answer these questions. And I even try to put them in lectures as well, because some students, it can be difficult at first, because a lot of times once you look at these quiz questions, you'll see 2 or 3 answers that seem to be right. And that's how nursing style questions are. And you really have to pull out that answer that is the best, essentially. What fits that question or the question stem? What's your priority with the patient? And take a look at that file. I also add in there too with pharmacology study tips. That's another one that you should look at as well. Quizzes are timed. I do give you a pretty good amount of time to take them, and usually they're only like 10 to 15 questions. So I do, mention too that you really should be taking these without the use of notes and resources. They shouldn't be open book, and they should be taken individually. And like I already mentioned, it's recommended that you review these quizzes, and I put the detailed feedback in there as well. In terms of assignments, our course assignments consist of our case discussions, essentially. That's basically the assignments that you will be completing, and I'll show you when we go through the course calendar. The big thing with nursing courses is that you really have to get that application of the course content. So in order to do that, we really have to apply the material and kind of put it in the perspective of how you would care for a patient and with pharmacotherapy. So it really, it requires more than just memorization. It really, truly, you need to learn how to apply the information in that professional setting. And we'll work on this throughout the semester, and, it helps you learn the material as well. In terms of our grades, we have the course systems content quizzes, which is 25% of your course grade. Midterm exam is 30%, final exam is 30%, and then the assignments, which are basically the course discussion forums, are 15% of your grade. As I mentioned in Part A, you have to, get basically greater than a 70% in the course. Academic conduct and professionalism. So please complete the course assignments. Individual effort, unless there's a circumstance where it should be done as a group, essentially. So same thing, like the quizzes, like I mentioned, they should be taken individually. You can read through this on your own, essentially. In terms of plagiarism, obviously, if you are, doing your discussion forums, you can just put a quick APA cited, if you use the textbook, just add it at the bottom of your discussion forum. I'm not entirely or very particular about your APA within the discussion forum, I'll be honest. I'm more concerned about you learning it and applying it. I'm not going to pick it apart and say, gosh, you didn't do APA correctly. Just don't, just make sure you cite it if you're adding, stuff directly from the book or from another supplement or another article. But I'm not, overly picky with the APA within the discussion forums, essentially. Academic conduct policy, obviously this is the same thing. You'll find this all within your School of Nursing handbook. Be aware of the add-drop policy, so those are the dates that are set by the university. So making sure that you're aware of those if you do decide that you want to drop the courses, essentially. Special considerations, I already mentioned this in Part A. Faculty course evaluation, I already kind of mentioned this as well. It's really important, so if you can, please provide feedback. We definitely appreciate it. In terms of instructor and student expectations, so in order to be successful, you really want to make sure that, number one, you're viewing this video, become familiar with the course structure, and I really try to keep it the same. So once you learn or figure out kind of how it's set up, each module will set up exactly the same. So once you get it, you move through pretty quickly, and it'll all follow in place just like the other course modules. And review the pharmacology study tips. I have a PDF document located in Moodle. That's just to kind of help you understand how to study pharmacology, because it does make it more effective with your readings and basically mastering the course content. Attend class meetings and participate in course discussions and activities. So those are like our course Moodle discussions. I do also add a midterm WebEx for review, and I also do one at the final. So we'll have a WebEx that we can meet online for like a Q&A session that will precede the midterm and final exam. The big thing with this, especially over summer, is stay caught up with the lectures. You have to stay on top of it because there is a ton of content. I'm not going to lie, pharmacology has a lot of content. But it's a great course. You'll find it interesting, and I do my best to try to keep it so that it's focused and, try to help you basically focus in on your studying and all that. So the big thing, though, is staying caught up with it. So make sure that you're reviewing the Moodle books, reviewing the lectures, and the assignments, obviously, on a weekly basis. Reading and comprehending the textbook or any supplemental readings posted. When you're reading, I would, like I said, I would try to go through the lectures and honestly kind of read concurrently with it. And that will help you kind of focus on your reading. I wouldn't read all those small little fine print in the textbook because there's a lot of different drug prototypes that they add in there. And I try to focus the lectures on the areas that you need to know. So I try to do that for you essentially. So I would take the approach of looking at lectures and the outlines and then kind of reading along with them. And that's kind of how you should approach it essentially. And the other thing too is the discussion forums or the case scenarios that we add. I try to add in the essential concepts in there. Those are other areas that are I always mention to review, like even before like the midterm, I would go back in and review like the course discussion forums because a lot of times I put in like the main concepts that you should really take a look at. So that's another study tip to kind of look at as well. Completion of required quizzes and exams on scheduled dates. I always give you a fair amount of time for the quizzes and exams, and I'll kind of go through that when we look at the course module on our Moodle site. Review the course quizzes after they close for the specific rationales. Stay up to date with course announcements. I think a lot of times, I don't know if students check in there or they don't check in there or they're not checking their OU email, but sometimes I find that students don't see the announcements. So I would always check in there just to make sure that there's not any announcements that you need to be aware of. And check your OU email too, because it will get sent to that as well. And please ask for help when you need help. I am always here to help you. And if you need any clarification or any other information, email me. I encourage you to email me. So I like to meet with students. I like to talk to them. I like to email them. So always feel free to email me. Respond to any emails within 24 to 48 hours. Respect rules of etiquette, and then participate in a thoughtful manner. As your instructor, my goal is to facilitate an effective learning environment through class activities, discussions, and lecture. Provide a grading scale, detailed grading formula for explaining how your grades are derived, informing students on policies such as attendance, withdrawal, academic conduct, etc. Arranging to meet with you whenever you need help, moderate discussions, respond to email within 24 to 48 hours. I'm really good about this. If you don't hear from me within a day, I would email my regular OU email account because I'm usually really, really good about it. I check Moodle at least once or twice a day. So if you don't hear from me and you need something, please just email me through the other route. And most importantly, like I said, I'm here to help you succeed. So whatever you need, please let me know. That's what I'm here for. Some other tips, like I said, I have that document up there that you can take a look at. The big thing with this, there's tons of content. Unfortunately, I can't really change that. It's stuff that you really got to know and go through. Keep on track with the content, the assigned readings. Don't fall behind with it. It really, with online courses, it does require a lot of independent studying and learning, because we're not meeting. And I can't, it's difficult because it's online, obviously. But I try to simulate an in-class lecture as best as possible. So I try my best to do that. There are a few lectures throughout the course that might be covered by Dr. Meissen. We've traditionally taught the course together, the two of us. So there's a few lectures in there that are done by her. I have been trying to make them all my own, so I would say the majority of them are done by me, and I'm still kind of working on that as well. But if you need any clarification, please let me know. And so like I said, I encourage students to reach out to me, maintain active participation. I always put little areas where you can put course questions under each module. So if you have a question regarding the content, there's a like a week 1 question forum. There's a week 2 question forum, and you can post questions in there, or you can email me. But the questions in there, you can respond to other students. So if you have the answer, you help each other out and respond to them. And then obviously if, it's something that I can answer, I will answer it as well too. So you can always post in there as well. So review the course schedule closely and plan ahead. But like I said, always double check Moodle to make sure that the dates are still the same. But it should be. The calendar is pretty much the same as what I have on Moodle. It's the same. But, just in case, just be sure to always check Moodle. It's accelerated because this course is over basically 7 weeks, so it does not allow for falling behind. So you really, really got to stay on top of it. I do try to offer those specific methods to kind of approach it, so take a look at that. Be sure to check Moodle frequently. You should be logging in every day, if not every other day at least, because I always put important updates in there. Sometimes I post them within the announcement forum, so be sure to check in there as well. Check your email. So sometimes I'll add new content if someone needs further clarification on a certain area, so I'll add different things as well. With online courses, you really have to have a consistent workplace that's free of distractions in order to study and complete assignments. There is some technical support numbers if you need it. There's WebEx support, which is the numbers there, and then ELIS support too. So those are two numbers that you can utilize if you're having difficulty with WebEx or anything like that. Because like I said, we will have a midterm WebEx and a final review WebEx. It's not mandatory that you participate. And I do put up a survey like that week prior for different dates to see what works best for everybody. And I'll do a survey basically with that. But students really like that. And it's nice because we get to talk for a few minutes too. So those are the two numbers. The course calendar, like I said, this is a tentative course schedule. However, it's pretty much, it doesn't really change, to be honest. Most of the time it's always the same. But as you can see, I have it split up into modules, and I do this because it gives you some flexibility. And I know the course it looks very heavy with content, but by going by modules, it gives you a little bit of flexibility. And I know you guys all have lives outside of this class, so I try to make it the best, as best as possible, essentially. So I have it laid out into modules. So module 1, module 2, they'll always will open, and, I'll open up each module, and I try to open them up early so that way if you want to start, going through it a little bit earlier, you can. But I do have it set up so that you can follow a weekly format. A lot of students still will follow that weekly format because it does keep you on top of it. You can't wait until that last week to go through all this information. It's too much to be doing that. You have to pretty much stay on top of it. But like I said, so over here, you'll see week 1, it'll go from like the 7th through the 13th. And then, I lay the topics out here. Week 2 is from the 14th to the 20th. The course introduction forum, that's just a quick introduction forum just so we get to know each other. Systems content quizzes, I will have it laid out that you have a content quiz for this section, and then you'll have a content quiz for this section. And it really makes it a little bit easier on you because the quizzes will coordinate with just this material and coordinate with just this material. So really, it's like 2 quizzes, but you can do whatever you want. You can take it at the end of this week, or if you want to wait and take it, during week 2, you can do that as well and take them both at the same time, however you want to go about it. The case discussions are, I traditionally always have them do like that Wednesday before like that last week. So I'll write all the directions in there as well too, but it's typically due like Wednesday, like your discussion post, and then you follow up and do one response to a classmate by Sunday. So we'll have one discussion forum for the entire module, and you'll understand this more when you kind of look at the discussion forum instructions. I'll have all the instructions basically within that forum. So same thing, we go to module 2. It's a 2-week increments. Like I said, though, you can stay on that weekly schedule, which I would definitely suggest, especially because this class moves really quick in the summer. Same exact thing, system content quizzes. You'll have a content quiz covering this section and a content quiz covering this section. You can take it at the end of this week, or you can kind of take it later, however you want to go about that. Module 2 case discussion, same thing. It'll be at the end of, like, it'll be due by this Wednesday, like during this week, that Wednesday evening, and then the follow-up will be due by that Sunday. And then we'll also have a WebEx for the midterm to kind of go through a Q&A session or answer any questions that have to go with the midterm exam. The exam obviously is online, like I said. It'll be on the 4th. It will be covering modules 1 and 2, so it's covering the content above. Afterwards, that's where we start module 3. So then we got week 5, week 6, same exact thing, system content quizzes that cover this section and one that covers this section. And then we have the case discussions that kind of go with both areas. Module 4 is a little bit different because it's only 1 week. This is kind of when we look at drug therapy for the immune system and cell growth. This is when we look at different antibiotics. We look at chemotherapy. We look at different agents like that. I do put up a module for self-study case discussions because it does help you kind of focus in on what areas are important to know, and it provides an application. So I will post those within the course form as well. And then our final exam is on the 26th. That covers modules 3 and 4, so it's non-cumulative. And then we'll also do a WebEx session for that as well. So as I mentioned, always go back to Moodle to make sure that the official dates and times, didn't change, but usually they're the same. But all the assignment instructions and all your readings are all posted on Moodle. So if you have any questions on this, obviously, please let me know. I will put up a video that looks at the first module, so it gives you an idea of how to approach it. Let me go back to our course Moodle site. So at the top, like I said, here's our announcement form, so check that. Our course internal email system, so please use that if you can. General student forum, you can use this for anything. If you want to ask other students questions or form study groups, or I do try to check in there too. But if you have a content question for like a certain module, I would post it in here. I'll open this up too, but I'll have week 1 questions, and I'm going to put up a video going over this as well. So this is the ATI resource text. Like I said, you can utilize this to study if you want to. It's up to you. It's just a resource. I figured I'd add it. We don't have the ATI within the summer courses or, within this pharmacology course currently. So you don't need to worry about the ATI exam, but, it's a resource that you can use if you want to look at it when studying. I did add a drug classification template on here that I made. It's not for a grade or anything like that. It's just a resource that you can use. A lot of students use it because you can actually lay it out and put like the classification, and then you'll see too, once you look at the pharmacology study tips, you'll see that a lot of these classifications will have common prefixes and suffixes. So learning them is a huge part to learning pharmacology too, because then you recognize what classification is by that. So you can add all that in the template if you want to use that. It's just there for you to use if you want. So I wanted to give you a brief introduction, and I wanted to say hello, and I welcome you to the course, and I'm looking forward to a great semester this summer, and I'm here to help you, so please feel free to reach out to me. And I will provide another video covering that first module and kind of go through that as well with you to how to approach the content essentially. So if you have any questions in the meantime, please feel free to email me and reach out. I hope you guys are all doing well, and I will talk to you soon. Thanks, and have a great day.